My kidneys were giving way and a living transplant has never come across my mind. I know this will need to involve one of my family members to sacrifice for me.
I was diagnosed with end-stage renal disease just 1.5 years after marriage. It broke me down.
I was living with a kidney problem for about 30 years. Nothing would have prepared us for this.
I used to rock climb back in school. Like when we got married, even our honeymoon was more of an adventure. We love to explore the areas of the unknown. When I was diagnosed with end-stage renal disease, right, a lot of those things that I used to do or we want to do, we can't.
It was pretty devastating to receive that news from the doctor on that day itself. I remember my parents were with me at the doctor's and it just causes like this big blank in my mind. I don't know what to do.
So I would think that none of my patients on dialysis have actually enjoyed the experience. Those on hemodialysis say that they get cramps during dialysis, they get low blood pressure during dialysis, they feel really tired after each session of dialysis, and all this takes its toll on them. For the blood dialysis patients, for example, they use their fistula 3 times a week. So that repeated cannulation of the fistula actually causes a lot of pain. The other thing that comes up quite often is the fact that they lose a lot of time because any time spent on dialysis is time away from the day. So people who have come forward for transplants have actually said that transplant is their best chance to be normal again, to stop missing out on life.
I think it is, perfectly natural for most patients to be worried about undergoing surgery. And generally, in fact, I would say the recipients who are supposed to get the kidney, they are the ones who tend to worry more for the donors. Most patients would view the surgery as like the it point, the point where they can foresee the most immediate risk. From a surgical point, I would say that transplant surgery is quite standardized. It has not actually changed for many years. And only surgeons who are specialized, who have undergone training and are actually recognized by our Ministry of Health are allowed to perform this surgery. So I would assure the patients that our transplant process, the surgical process itself is actually very tightly controlled. We hardly take any risks at all.
Sometimes it can be quite a bumpy journey before their loved ones can be confirmed suitable to proceed with the transplant or organ donations. We want to assure that sometimes the evaluation process may turn out longer than expected and they may end up spending more time in the hospital for more clinical investigations. All these additional checkups are arranged to ensure that everyone is safe for these operations. We actually encourage that our patients to ask any question they have about kidney transplant, and we are always here to help them. It is also our priority to make sure that the donor and the recipient are coping well psychologically when they are given with a lot of the new medical information regarding kidney transplant and coping with the multiple appointments and the checkup needed. One of my greatest joy is to be able to tell our patients and the donors that they are suitable to go for the kidney transplant. It really makes my day when I see them so happy and emotional when they receive the news.
I think the thought of doing dialysis was quite frightening to me because I lead a very active life. So the thought of being on dialysis and being strapped to a schedule, strapped to a machine, wow, that was quite difficult to accept. That I'm now locked in this routine,
The social stigma that we had around our family or those people that knows we are going through the transplant, it kind of gives the negative vibes towards us because the social stigma that the community has is that whatever that belongs to you has to go back to you at the end of the day. But we always hold dearly to ourselves is that everything happens for a reason and God knows what's best for us. And when Shahrul wanted to give a part of his kidney to me, if this is what God has planned for us, we will just follow through. And like our coordinator mentioned, this kidney transplant is not a cure, it is a treatment. And we have to take care of it, not only for myself but also for Shahrul.
Actually, I thought to myself, like, can I just go on dialysis? I don't want any transplant at all. When I was in hospital for more checks, then at that point of time, due to certain tests done, my creatinine level shoots very high, and at that point of time, Dr. Key actually told me that I need to do dialysis. So my sister found me a private dialysis in the area that I'm living. So when I stepped in and I saw other dialysis patients, I start to feel a bit scared because of the pain they are going through every time the needle is being poked through. Then gradually, like a few weeks down the road, right, I start having cold feet about my decision on going for dialysis forever.
Patients can experience different emotions as they undergo kidney transplant evaluations. They can be quite nervous and anxious at the beginning, and gradually with better explanations and clearer understanding towards getting a kidney transplant. Most recipients and donors are concerned with the short and the long-term health risks for each other. Other concerns include the cost of the operations as well as the many tests that they have to undergo before the actual transplant operations. As a transplant coordinator, we are here to help and provide guidance on what to expect, to help them to overcome their fears, making sure that they are mentally and physically prepared for the kidney transplant.
Well, for one, my patients on transplant, they definitely live a longer life than those people who remain on dialysis. Well, secondly, transplant also frees them from dialysis. So patients feel better, they feel better about themselves and their body image, and they get to spend more time with their friends and their family. Cost-wise, transplantation is definitely much cheaper than dialysis as a long-term option. They eat a more variety of food. They get to travel again. For the other of my patients, they actually have children. They learn to start their family, become parents. So all in, transplantation definitely gives them the best chance to have a fuller and longer life.
So living kidney donor surgery is actually considered a major surgery. Why? Because we are removing an entire organ from the donor. Having said that, the actual risk of having major complications from the surgery is actually very low nowadays, less than 5%. I, however, do have the duty to counsel my donors that there is this very rare risk of donor death or mortality. 1 in 3,000 donors. This is a very sobering thought, but this is based on international data. I'm glad to say at SGH we have been fortunate enough never to have a donor death. We routinely perform our donor surgery through small keyholes, or known as laparoscopic surgery, and this has been performed for more than 10 years already. This allows our donors a very quick recovery process, and most of my donors nowadays go home within 2 days of surgery. I view my donors as very special people. Why? Because there are no other group of people that I operate on who actually they don't require surgery. They are voluntarily going for surgery for the benefit of someone else, their loved ones. Therefore, I would say that I view them as special, and we take a lot of precautions. We are extra careful and we try our best to minimize any risk to this group of donors.
First of all, I think that was is quite difficult initially because she don't want to anything happen to me. But I told her, I accompany you to the dialysis center. I look at those patients, and it's really sad to see them suffering. So, look at my wife. I think she deserves something better. As a husband, I think I need to step forward.
I think the biggest fear I had was what happens if it's incompatible. I think that would have put us into a very tough spot, a rock and a hard place, so to speak. If I were to tell you that death did not feature in my thoughts, I would be lying. But I guess that's something which I felt that it was the right thing to do, and we just have to do it.
Emotionally, I'm already ready to give. So it's going through all the tests that has been laid out for us. So I recall The first test was to check how strong my kidney is. And I recall the coordinator Constant told me that you may be healthy, but you must reach a certain benchmark before we agree to this transplant. So I recall the only emotion and only challenges or fear that I had throughout the journey is every time when you call me for tests, what if I don't make it? That means she doesn't stand a chance. So it is all about whether I can give. For me as a donor, right, nothing changes after the transplant. I'm actually very active before the transplant. After the journey, I started resuming back all my sports activities, I think 3 weeks later.
For me, I feel that this whole transplant thing, right, is very life-changing. Okay? Because now I'm so-called leading the life that I want. I don't have to be bounded in a chair on dialysis.
The experience that we faced through, for us personally, we won't forget until we left this world, of course. Because it's something that is a turning point in our life. That when she diagnosed with kidney failure, and I decided to give the kidney transplant to her. So personally, it's a big sacrifice for both of us. Not only for both of us, in fact for our family also.
We would not have done this not only for ourselves, but also the support of our family members, the kind of the strong foundation that we have with our family and friends that knows about all our condition.
I think it's a bittersweet experience. Bitter in the sense that we have to go through this, and I have to get something so precious from him, a part of him. Sweet in the sense that we had a wonderful team. My experience shows it. We are different blood group, and actually they told us that the post-transplant journey, the first 6 months will be very rocky. In fact, the first 1 year will be very rocky. They expected me to be in and out of hospital very often. But I did not. Thank God I did not. It was smooth.
I was actually very surprised that after such a major surgery, I could leave the hospital after 4 days. I'm glad that our lives actually has been almost back to normal. And I think life goes on.
Give a life.
Live a life.
Give a life.
Live a life.
Give a life.
Live a life.
Give life.
Live a life.
Give a life.
Live a life.
Live a life.
Live a life.